Welcome to the podcast entitled Health and Wellness Briefs, Tactics for a Better You. I'm Dr. Megan Amaya, Associate Clinical Professor and Director of Health Promotion and Wellness at The Ohio State University. This podcast series is brought to you by Buckeye Wellness in the Office of the Chief Wellness Officer to provide you with evidence-based micro-learning modules to optimize your personal health and well-being. Our podcast starts by giving gratitude to someone or something in your life. Gratitude is one of the simplest research-based strategies to improve your health, happiness, and well-being. Please take a few moments right now to think about who or what you are grateful for today. Everyone, welcome. I am delighted to be joined by a colleague from The Ohio State University, Harry Warner. Harry Warner is the Associate Director as well as Director of Outreach with Student Life's Counseling and Consultation Services at The Ohio State University. We affectionately call Counseling and Consultation Services CCS, in case you hear it referred to as CCS at any point in this conversation. Harry's been at Ohio State for a little while, dual degrees from the university, and Harry received his graduate degree in counselor education in 2009. Before joining CCS, Harry worked with the Maryhaven Addiction Research Institute and the Ohio Suicide Prevention Foundation. Now, Harry's first role at CCS was as a senior staff clinician specializing in support to LGBTQ students. And shortly after starting with CCS in 2012, Harry began leaning into the outreach efforts around mental health. Harry believes firmly that outreach is primary to the work of enhancing mental health for all. Additionally, Harry is an executive board member for the Association for University and College Counseling Center Outreach, a native of Northeast Ohio, completely dedicating both professional and personal to promoting positive mental health and well-being for our Buckeye community. So with that, Harry, welcome to our podcast. So excited that you are joining us. We really appreciate your time and energy today. And I'm just going to get right into the questions if you're okay with that.
Yeah, sounds good. Thanks,
Yeah,
Megan.
it's a fascinating topic, such an important topic, and one that a lot of people, adults, adolescents, I mean, they're all just, this is the forefront of our culture right now in our society. Let's start off big picture. What are some of the most common mental and emotional health challenges facing adults today? And I say adults, that's a pretty wide continuum there. So however you want to best answer that. And along those lines, like what is the data showing for the adult population?
Sure. Um, yes. Yeah, adults thinking, across the board, our college students, employees, all of us here at Ohio State. So um, the most common things I say would anxiety. It's always been number one for years. Depression, stress, loneliness. I don't think any of that's real surprising. And the thing is, it's not just one of these things. It's rare that someone would show up and say, I'm just here for my anxiety. Oftentimes you'll hear it say my anxiety and depression or depression and loneliness, or it's multiple things. So mental health is extraordinarily complex and affected by a combination of biological, behavioral, and social factors. So it's a lot. So I'll start with my observation and back it up with some data. And I think zeroing in on anxiety could be helpful since it's the most common problem. Um, so a lot of folks will talk about mental health concerns as something that exists internally. So you might hear like it's a me problem, or it's all in your head. You might hear some of these more stigmatized remarks, but most of the time it's not. So let's talk about anxiety. In 2024, the American Psychiatric Association published a report that 43% of adults reported feeling more anxious than they did the previous year, and that's up from 37% reporting feeling more anxious in the same time the year before. So respondents pointed to anxiety related to current events as the reason for their increased worry. And then they talked about lifestyle factors such as stress and the lack of sleep that pile on top and make it even more difficult to manage anxiety. And for those at home, anxiety can be described as persistent worry, difficulty managing that worry that often results in physical signs and disturbance in behaviors. So managing anxiety is really important. And if we're not gifted the time to manage anxiety and know what our anxiety is about and what works for us, then it can spiral. But so I would say like anxiety, if you want a place to focus with the most common mental health challenge.
There's a lot in those statements that you just mentioned. My head went into about six different directions with it makes sense what you're saying, like current events, and I can see why anxiety has been on the rise. And also, what popped into my head as you were the very end was really poignant for me. It's about if you're able to find that space where you can dig a little deeper to find out what are the, I don't want to use the word mechanisms, maybe that's a strong word, but what are the reasons why I'm feeling this way or that way? Because that's truly where we can get uh, some insight into what might be causing these things and then being able to move forward, whatever that means. I mean, there's certainly different strategies and practices on that one. And to me, the anxiety, I mean, all of it is very concerning, but I see this in a lot of the students that I teach, and I know you see it in students that you interact with, and it
Um,
is concerning for parents and family members and friends, and you never want to see anyone suffer. I know I'm kind of going off on a little bit of a tangent there, but that's a lot, and it's important for people to hear that message about these mental health challenges. You also had a nice segue in there because the data showing what the data showing, people are talking about mental health challenges now, and we are in 2025. So over 5 years from the start of the pandemic, a few years since, we've started to come out of it, depending on when you identify coming out of the pandemic. So how is the conversation evolving over the last, I've seen a couple years. I don't know if you want to go back all the way to 2020, but certainly over the last few years, how has the conversation around the mental health challenges evolved?
Sure. Yeah, and just also bouncing off what you had mentioned there, like if I'm in a classroom of students, for example, I'll start by saying to them, if we took time to ask every one of you, what is mental health? There would be a different answer from every single person in the room. Um, so I think I'm glad that you highlighted that. But so the conference, so one, increased awareness. We're honoring Mental Health Awareness Month right now. People are talking about it. You can't be on social media for long at all without seeing a reel or a video about somebody talking about mental health in some way. Um, uh, Another thing is workplace mental health is certainly in the conversation, especially in terms of burnout or uncertainty or whatever it might be. One thing I think about there is like, what does it mean to be in person or working from home? And I think the jury is out on that one. And obviously, it depends on the type of work you do. If your work requires to be in person, there's no choice. But I know that I can respond to emails perfectly well in the comfort of my own home. But again, it's really complex. But people are talking about mental health in the workplace. Um, so then also impact on mental health differs related to identity. So this one's very charged, and I believe it needs more open discussion about what that means. But what I'd like to say is that for every one of us, our meaning is informed by our culture, identity, background, etc., and we all need spaces to express and process that. I think there's a cohort effect, especially coming out of the pandemic. Like what would it be like? I'm thinking if I was a student starting my college experience in 2020, when we were in, I guess, the beginning-ish of the pandemic, and that looks very different than you know, I know that I was thinking about starting my graduate program, and I would not have thrived in the same way if I didn't have that immediate connection in person with my cohort. But then we think about kids in elementary school or whatever it might be, where so many things, will impact. So I don't know what the long-term effects of that will be. But okay, so the biggest one in the conversation is here. I would refer folks to the 2023 report from the Surgeon General, where he had talked about the epidemic of loneliness. So in the review of the literature, he found that 1 in 2 adults reported loneliness, and and it's more than just a bad feeling; it impacts our physical health as well. So folks reporting loneliness are at greater risk of cardiovascular disease, dementia, stroke, depression, anxiety, and premature death. So looking at this report, they talk about it has the same effect apparently as smoking 15 cigarettes a day. So sounds pretty serious. So those are some of the things that pop out to me in the conversation, post-pandemic or in this stage of the pandemic, however you want to refer to that.
We could go down a rabbit hole with what you just were talking about. My brain went to, you were like, oh, it affects your physical health. It affects how you spend money. It affects your social interactions. For the listeners out there, we have 10 dimensions of wellness at Ohio State. And so I could see it contributing, impacting, affecting, multiple words you can use there. A number of those dimensions could be positive, and then it could also be negative as well. I hadn't thought that through yet, so that's really fascinating. I want to talk about some best practices. I realize people have heard a lot, but I definitely want to get your ideas and recommendations as a mental health professional. Before we go there, toxic behaviors. We've heard about this topic. I don't know how familiar the audience is with the concepts behind it. Hoping you are able to elaborate a little bit for us on some examples of a couple toxic behaviors that can harm mental and emotional well-being, and then how they can be addressed.
Sure. Um, so when in thinking about this question, I think about sitting with people. And I think for me, I think toxic behaviors kind of happen in the way that we think about ourselves in the world, and how toxic narratives can catch. I'll give you an example. I think avoidance is a toxic behavior. So when working with this, I think you'll hear people talk about procrastination and laziness, and I think those words feel pretty judgmental, and I think it's really avoidance, where I don't like personally. I don't think that laziness exists. I think it's made up, so that way we can judge ourselves or judge other people for what we see that's not being productive. So for there, reflection is um, is important. So to understand, so I'll talk to students and I'll be like, hey, like I don't think you're lazy. I think you're avoiding something. So let's talk about the emotion that's connected to that thing that you're quote unquote procrastinating around. And if you can treat the emotion, you can do the thing. And I'm not talking about just work, or getting assignments done, but this could be anything in life. So another area that I think is toxic is isolation. And I think isolation, not just, thinking about yourself just being literally alone, but isolation when you're among people, is a toxic thing that is happening. I don't know if it's a behavior or a dynamic or something, but it's toxic. So withdrawal is always a sign that someone may be struggling. So you can see that in self and in others. If I'm withdrawing and I'm avoiding people in this case, then that's not working for me. Or if you see someone else kind of disappear, their door is always shut, whatever it might be, it could be a sign that someone is struggling. Not necessarily, it could be a sign. But and then it's so ironic because the very thing that would treat isolation, connection, coming back to this loneliness piece is difficult because the more that we're isolated, it kind of compounds. You're isolated, you start to have misgivings about people, not sure about how this interaction will go. Will I come off as awkward? Will they be strange? Will I say something messed up? And then make myself, and I'm just going to not just avoid the whole thing. So isolation can compound, but that's a toxic thing. So I'll tell students, I'm like, do the thing and do it scared. I think this may be on the social media somewhere, but do it scared or do it afraid is out there. You have to have courage to make connections. I think about courage is the root of the word courage is cour, which is a French. I'm sure a French person would say I'm not pronouncing that correctly, but it comes with heart. So you have to have heart in the things that you do. And in this example, making connections with people is a way to, get at that toxic dynamic of isolation. And there are other things too, but those are the two that I really wanted to highlight with our time.
Yeah, and certainly we could spend an hour talking about each one of those. The first one, when you were mentioning like laziness, it's like the person can label themselves and it becomes a part of their story. When we can take away a label and get more to what you were saying, okay, you're potentially avoiding something. That's not a label. That's an opportunity for change because it's more about a behavior that might be able to be adjusted through thoughts, feelings, those
Yep.
kind of conversations, discussions, etc. Am I off base or
No, I think you're right. And then what that
okay?
does is like when you take the frame, when you pivot the frame away from there's something wrong with me to like what do I need? And then that unlocks your potential. So then you can come at
Yeah,
it with, and really live up to your potential and whatever that might be.
yeah, yeah. Oh, this is really cool. I still want to come back to the practices. I'd like to, because you're in this space every day and you're seeing what are the latest trends and some of the, I'll use the word therapy broadly speaking. What are you seeing out there that is changing and or maybe is already like full 180 from where it was 2 years ago with the services and care for mental health?
Yeah. So that's a really good question. I had to really think about this one, but I hope positive things. I'm hoping positive things. So one trend that is kind of surprising to me. So through the pandemic, there was a lot of develop like obviously telehealth was the only way that we could do a lot of the things that we were doing. Um, and I think that um, while there's certainly, I think it's an innovation, I would call it an innovation. I think there's certainly a place for telehealth considering time constraints, mobility, reaching people in remote areas, et cetera. However, um, interesting, like at the counseling center here, students are still primarily wanting to come in person. And to be honest, that heartens me a little bit because, this belief in authentic connection, students are still asking to come in person. They'll walk across campus to still come sit on the couch and talk with their counselor. So, for people that are talking about, all things mental health moving to the use of technology, I think it has its place, but I think we're calibrating on what that looks like. Um,
That
and then
touches my heart as well. I always like to say there are pros and cons to the tele-Zoom world we live in and the in-person. I am more privy to the in-person, as you're alluding to as well. There are just that connection is deeper. It's not that you aren't able to get a connection in telehealth.
Sure,
It's different. It's different. Yeah.
it's just not the same. I mean, you can go through a fast food drive-through or you can go to the farmer's market.
Yeah.
Both of those things will get
Love
you
it.
food,
Yeah.
but
Yeah.
what really hits?
Yeah. Our last question will be for the individual who's listening to the podcast right now. Some best practice strategies. You are the expert in this field, and we hear a lot. What do you recommend about some tools in the tool belt that individuals can use that will really help enhance mental and emotional well-being?
Sure. So at the foundation of that, and this is the first thing, like if a student comes and sits on my couch or whatever it might be, the first thing I think about are like, what's part of your routine and your behaviors that keeps you healthy overall? So you have to attend to sleep, nutrition, physical activity. I think those are key. Um, More of a baseline thing. And then, finding, for example, a mindfulness or a meditation practice that works for you. There's all kinds of different ways to do that. So that would be like the one bucket. The second bucket is uh, media. I would say that to limit screen time, to be aware of your screen time. We all have different um, expectations and how we're doing our work, but you want to find a balance of staying informed, but then also taking a break from that. So, doom scrolling is a real thing. Um, the third bucket would be social connection. This is, I think, a theme of, what we're talking about, but, do your own self-reflection and ask yourself, where am I in my social needs? And meet yourself where you are. So maybe in one dimension, you have some really good friends, but you need some other outlets, some others community or whatever it might be. One of my favorite things that I'm doing right now, my boyfriend and I, we have made it, um, we go to the farmers market a lot, and just getting to know people, just getting to know random people in the community, and I imagine how much time and passion people put into their produce or whatever it is they're selling. Find places where you can practice social interaction to get back into it if that feels like something that's overwhelming or that you want to avoid. And then the last thing is reach out. If you need help, reach out. That is the best practice in mental health, is reaching out when you need more support. At Ohio State, I think we are very fortunate for employees. A good place to start is with the EAP program. I believe the website is osu.mylifeexpert.com is a good place to start. And then for students, we have a Go link, go.osu.edu/talk to a counselor, and you'll see your options there. Okay, this is the last thing I want to say on this is a lot of folks may think, okay, so if I want to talk to a mental health counselor, I'm signing up for years of psychotherapy. And it's not that. You can have a singular conversation with a counselor that can be very helpful for where you are. So do that, try it out. Um, there's really nothing bad that can come from asking some questions or just talking about where you are and then go from there. And professionals can help you find the plan that's tailored for you for what you're looking for. So reach out when you need to.
That's well stated at the end. I say that about personal training too. You don't have to commit to anything. It's a conversation, maybe it's a short train. You just learn about whatever it is that needs to be discussed, and then you can make the decision if you're going to move forward or not. So, yeah. Harry, this was awesome. Really appreciate your insight and your expertise, as well as your time and your energy. I mean, energy to the students at Ohio State, the energy that you are as a part of this podcast and bringing that, much appreciated. And I know we will be in touch soon, but thank you so much for being a part of our podcast.
Yeah, thank you, Megan, for the invitation to talk about this thing that I know we both care about a whole lot.